Guys, welcome back to my YouTube channel. It's your boy here, Lore, aka Larry, aka itslorelari. Continue subscribing, liking, and sharing my content, and may God bless you so much. So today we are going to talk about another episode of Health Matters, focusing on a specific disease or condition called HIV and AIDS. Join me. Yeah, so today we want to talk about HIV and AIDS, and with me here I have a special visitor, friend, colleague who is so much knowledgeable again in matters HIV and AIDS. So welcome to the channel as we discuss. Yes, how are you, Doctor?
Oh, fine, thank you.
Yes. So as I said, we want to understand what is HIV/AIDS, and you will introduce yourself, tell us your name maybe, and then also tell us what is HIV and also what is AIDS and what is the relationship.
Okay. Thank you very much for inviting me to your program.
Yes.
And thank you also for letting me have this chance to speak to my fellow Kenyans about HIV and AIDS. And just to go straight into your directions, my name is Martin. I'm a general practitioner of medical services, and I work in Mbakasi offering services to the clients. So to answer your question, the first question,
Yes.
What is HIV and AIDS, and what is the difference between the same? So first of all, let me begin with HIV. An infection caused by a virus
Yes.
from you remember biology, we were classifying viruses.
Yes.
So it is a retrovirus.
Yes.
From a retroviral family,
Mhm.
and the species called lente. Okay,
Yes.
and that makes it a bit special
Yes.
virus,
Yeah.
because the lente viruses are viruses that replicate within minutes and seconds, and that is why until today
Yes.
we have not been able to get the medication to cure HIV because of the lente virus. Then the AIDS, now it's acquired immunodeficiency syndrome. A syndrome is a combination of signs and symptoms that manifest out when it has advanced in stage.
Okay.
When it's still HIV, it's an infection. Human immunodeficiency virus.
Yes.
So the virus causes someone to have deficiency in immunity.
Wow.
Okay?
Wow.
So deficiency in immunity how? Like a country has its defense forces.
Yes.
The body has also its defense forces, of which primarily it's called the CD4, of which the CD4 are the T helper cells in the body,
Okay.
which primarily prevents the body against any other infection.
Infection.
So the HIV virus
Yes.
attacks that defense of the body.
Okay.
Once the body has been attacked, then the CD4 count goes low,
Yes.
exposing your body to other infections that can easily come in, very, very minute infection, yet they present as severe because your body does not have the ability to fight that infection. So when it progresses now to the severe form, it has advanced, now it becomes a syndrome, now a disease, now the HIV disease, of which currently we call it an advanced HIV disease, of which now there are those symptoms of HIV that are visible in that particular patient.
Wow, that's wonderful, and that's great knowledge. And I think for my viewers, in a basic and layman's language, that's what Dr. Onyonyi here is able to say. And we also want to know how, okay, we have already understood how this virus is acquired. And how is it transmitted? Maybe for my viewers and for the sake of that person who is lay, we have had HIV over a long period of time. But somebody might want to understand how is it transmitted, and also talk about something, how is it acquired.
Okay, yes. Thank you very much, because that's again a very good point that I want the viewers to understand about HIV.
Yes.
Because there are so many myths and misconceptions out here about HIV transmission or acquisition that has made so many people have what you call stigma. And maybe if you have time, sometimes we will talk about also stigma when it comes in. But HIV is a lot of form of acquisition of HIV.
Yeah.
But the most common that people think about mostly is promiscuity.
For sure.
Promiscuity is just one among the many causes of HIV.
Yes.
But let's begin primarily from.
Yeah.
I love children, so let's begin from children.
Yeah.
There is what we call vertical transmission. Vertical as vertical goes.
Yeah.
So it is from the mother to the child.
The child.
If the mother is HIV positive,
Yes.
then she does not take her medication very well,
Yeah.
then the virus goes up.
Yes.
What we call high viral load.
High viral.
The baby is at risk of getting the HIV from the mother, either in utero, during delivery, or during breastfeeding.
Sure.
Okay. So in as far as children are concerned, so a baby can either be born with HIV from in utero,
yes,
then during labor and delivery. Remember the procedure during labor and delivery? Yes. So a mother can also give the baby, can transmit the infection to the baby during
that
labor and
process.
delivery. Then during breastfeeding, remember sometimes a mother has cracked nipple, so there are so many.
Yeah, it's true. We really wanted to understand during that breastfeeding period.
Yes.
How is it transmitted? Is it through the breast milk? Does the breast milk carry the virus itself, or it's you were mentioning about cracked nipples?
Yeah. So what happens is the breast milk also has small traces of the viruses.
Okay.
But since the virus is ingested in the gastrointestinal system,
yes,
it does not. The risk of acquiring is very minimal.
For sure.
Because the breast milk is sweet. But what increases the risk is not directly the blood is concerned. Because remember, in body you have those parts that have the HIV receptors in the body. Okay. But they are not. There are those parts has low and others have a higher number of receptors.
Yes.
So for this case, during breastfeeding,
yes,
so the risk is very minimal, and that is why you find some mothers, even if without intervention,
yes,
they end up not infecting their children through breast milk. But once now the breast complicates and have the cracked nipples, then it's a bleeding breast. So the baby sometimes ingests directly the blood from the mother, and children also have, they love putting things in their mouth, so they have small cracks in the mouth. So that increases the risk of the baby acquiring infection from the mother. So with good maternal care and baby care, ensuring the mother does not have high viral load, and the baby is breastfeeding well, and the nipple is not cracked, we can minimize the risk of transmission from the mother to the child. So the second mode of transmission, that's from the mother to the child.
Yes.
Then we do blood transfusion. Sometimes you do in hospitals an urgent blood transfusion.
Yes.
And if the blood is not properly screened for infections, one of the infection that this recipient of the blood will have, it's HIV.
For sure.
So patient can also acquire HIV through blood transfusion.
Wow.
Okay. Then another common thing that happens mostly, you end up, you see your friends, I'm cutting my nails, doctor, let me use your nail cutter. I've punctured my skin.
You also puncture.
Yes, then use the same. So there is blood from me into you.
Maybe
there's a high risk.
That will bring me to that other point where when that specific thing happens, how long does a virus take to survive? Maybe because people will fear maybe using even the barber shops and all those places, because now they are fearing what that point you have said.
Okay. Different studies have given us different results. Okay. But it's between 5 to 15 minutes on dry surface. On a surface.
Wow.
Okay. The virus will be dead. And that is why when you're in barber shop, you need not to worry.
Yes.
Because there is no direct blood you're seeing. But now you see immediately I've finished using the nail cutter, then you're using it, then you see, it increases the risk. Or sharp objects, for example. When guys, like we're using, for those guys who use injection drugs. So I've injected my drug, then you want to inject. So the same syringe and needle I've used, fresh, you inject with it. You're at a higher risk of also getting HIV infection. Then the last one that it's common is through sexual contact with a person that has HIV. You also get HIV. And another common thing, I had a case of accidents. You see, you're traveling in a car, then it involves an accident. Then there is injuries and wounds, then there is spillage of blood. So people have seen clients who actually have contracted HIV through spillage in road traffic accidents.
Wow. Thank you so much, Daktari. I know HIV is a wide, broader condition that affects people. Either you are infected or you are affected in one way or the other. So in the next episode, we are going to tackle an issue whether is this HIV curable, or do we have measures in place to cure the disease or to suppress it in one way or the other. So for us to do that, you feel free to follow us in the next episode, part 2 of the discussion. As I said, this guy is a very knowledgeable guy and is going to give us a lot of details. I'll share our email address down below, the link, so that you can write to us if you want him to come to your institutions, to your workplaces, to educate you. We can have a discussion over there in terms of the modalities of how that can happen. Thank you so much, and ciao ciao, bye.